Hi all, welcome to this interesting session, Wound Healing Science and Management. This is relevant to all age groups, that is from the age group 0 to the old age. So it is highly interesting and very much relevant to our daily life. So we can go to this topic. Before that, myself Dr. Shilpa Joy, I am working as Assistant Professor Senior Grade, Sri Ramakrishna Engineering College, Coimbatore, Tamil Nadu, India. So shall we move on to this topic? Today's presentation topic is Science of Wound Healing Mechanisms and Management. So this is actually, as I told you, very relevant for all age group, whatever field we are working, whatever it is. This is actually a daily practice done by our body to heal the wounds. So before going to this topic, there are some prerequisites, like we should know some concepts to understand this topic deeply. So first we have to understand about the cells. So cells are actually 30 to 40 trillion cells are there in our body. These cells are actually categorized into 200 different cell types, and so some examples of the cells are actually shown in this here, that is the blood cells, surface skin cells, bone cells, neurons, columnar epithelial and globular cells, cardiac muscle cells, skeletal muscle cells, smooth muscle cells. Apart from this, we have n number of cells in our body for the daily functions, and these cells, they together form a group called as tissues. So mainly these tissues are classified into 4 types. One is connective tissue. Connective tissues are actually involved in the connection between the cells, bone and muscle connection and all these things. Connective tissues are involved. Then next is the muscle tissue. Muscle tissue is actually, we know that for maintaining the structure of the body and for the action like contraction, action, relaxation and all, muscles are required. Then epithelial tissue. This epithelial tissue is the tissue that is seen along the surface of our like skin and also along the surface of the internal organs. Now the last classification of tissue is the nervous tissue, that is nervous tissue for the response, stimulus response, all these things we know. So that is coming under the nervous tissue. Is actually seen in the brain spinal cord for the connection and giving the stimulus response and all these relations. So these tissues combine together to form the next level of organization, that is nothing but the organ. So in this picture we can see the organ system, that is the organ here is the heart. So cells, I told you, the group of cells, they form tissues, and these many different types of tissues, they form the organ. Here the organ is heart, so the cardiac muscle cells will be involved, blood vessels are involved. So many different tissues, they combine together, form the organ, and at last the organ system. So this organ system is nothing but the circulatory system. So like that all the organ systems are developed in this mode. So apart from the cells, tissue and all, we have to have some idea about the vascularity and angiogenesis also. So first we will go with the angiogenesis. Angiogenesis is nothing but it is actually the growth of new blood vessels from the existing one. So whenever an injury and healing happens, new blood vessels should be formed. This phenomenon is called as angiogenesis. Next topic is like vascularity. This is nothing but the overall network of blood vessels in a tissue or an organ. So the angiogenesis, if you see, it is like pictorially it is represented here. So this is a stable blood vessel where there is no problem, nothing, and whenever there is an injury or breakout, the release of the blood contents will be there, and these when the contents are released out, platelets, a group of cells called as platelets will come into play, and they will release certain growth factors and signaling molecules for the healing. So in the next stage, in the migration proliferation stage, we can see that a new blood vessel is sprouted from the old one, that is nothing but the angiogenesis, and then it will undergo morphogenesis to give the full growth of the blood cell. So now we can go into the topic of today's session, that is wound healing. So wound healing is nothing but a repair that follows the injury to the skin and other soft tissues. So actually the healing is not a simple process, it is an interaction of complex cascades of cellular events, and that is required for resurfacing, reconstitution and restoration of the tensile strength of the injured tissue. So that tissue's tensile strength should be brought back with an effective healing. Now healing is actually classified into 3 phases. First one is inflammation, second proliferation, and third one is maturation. So we will just see what are these phases. The first one I told you, that is inflammatory phase. In this mainly whenever a blood outflow is there, whenever there is an injury, naturally blood vessels also will break, so that the blood will be coming out of the blood vessel. So first we have to stop the blood flow. So that is mainly happening in the inflammatory phase, that is a clot will be formed to stop the blood flow. The next phase, that is proliferative phase. In this the proliferation of the epithelial tissue, the connective tissues will take place to close the wound. The last phase, that is maturation phase, in this the collagen will be cross-linked together to give a much more remodeling of the tissues, and also the tensile strength of the scar will be maintained. Now if you go into these phases in detail, first one is inflammatory phase. In this phase actually happens within 2 to 5 days of injury, and I told you that there are 2 stages, that is first stage is blocking the blood flow, that is called as hemostasis, followed by inflammation. So in hemostasis, the main action that is happening is vasoconstriction. In vasoconstriction, what happens is that the blood vessels will be constricted to restrict the blood flow. Also the platelets are aggregated to the site of injury. These platelets, they release certain signaling molecules also, which will invite fibrinogen, so that the platelets and fibrinogen, they will form a clot. This is called as platelet plug, and this thromboplastin is also involved in making the clot. The next procedure is inflammation, where the phagocytic cells like neutrophils and macrophages will come into the injury site for protecting the tissues by killing the infecting bacteria, to remove the debris and all these things. So proliferative phase, I told you it is the second stage, which happens 2 days to 3 weeks time period, and mainly the fibroblast cells, granulation of those cells will take place, and these granulated fibroblasts will release certain signaling molecules which will signal to produce new capillaries. Also the wound edges will contract and reduce the wound size. Again the last stage is epithelialization, that is epithelial cells will be undergoing mitotic division, and they will try to close the wound. The third phase is remodeling or maturation phase. This happens from 3 weeks to 2 years. So it's actually a long process, where again the new collagen will be forming and increasing the tensile strength to wounds. Also the scar tissue, that is the result of wound healing, that scar tissue will be having only 80% of the tensile strength compared to the previous normal condition. So this is what is the remodeling or maturation phase. Now if you go to the in detail about the inflammatory phase, here we can see that within 5 to 10 minutes period of injury, you can see vasoconstriction stage will happen, that is closing the, not closing actually, that is restricting the blood vessels, so that the blood flow will be reduced. This vasoconstriction is actually ensured with the help of epinephrine, norepinephrine, prostaglandin, serotonin and thromboxane. So these signaling molecules actually help in the vasoconstriction. In inflammatory phase itself, we can see that, as I told you, platelets are involved in this. These platelets will come to the wound surface, and they will attach to the wound surface actually. And when these platelets are coming to the wound site, because of the wound, collagen is now exposed, which is released by the fibroblast. That collagen is actually exposed, and these platelets and collagen, they will interact, and they will introduce the proteins like fibrinogen, fibronectin, and also the von Willebrand factor, thrombospondin, to the wound site. All these together, that is platelets and the clotting factors, they together will form the clot. Also you can see that the neutrophils and macrophages, they are called as the inflammatory cells. They also are directed towards the wound site with the help of the signaling molecules released by the platelets, and these molecules will help to kill the infectious bacteria, anything is present at the injury site. Also they will remove the debris, necrotic debris, and activate the fibroblast response. and this inflammatory phase actually lasts about 24 hours, and next stage is the proliferation phase. So in this stage we can see that is in the inflammatory stage, the vasoconstriction, the platelet plug formation to block the blood flow, and formation of the clot, so that the blood flow is now restricted. Now in this mainly certain growth factors are released by the platelets. They are called as the PDGF, that is platelet derived growth factor, certain proteases, vasoactive agents, all serotonin, all these things are also released by the platelets for the formation of the clot. So fibrin is nothing but the clot enhancing protein, so that is mixed with the platelet and a clot or a plug is formed. So here this is a pictorial representation of the inflammatory phase, that is the first one is the, here we can see the blood vessels. So the blood vessels are now broken due to the injury and the release of the things are happening. So this will be the first phase, that is vasoconstriction, that is the size of the blood vessel is now restricted or constricted at the site of injury, and because of this the blood flow is now slowed down, and after that the platelet plug formation, that is the platelets along with the fibrin and other proteins, they will come and deposit at the injury site. Here it will come and deposit at the injury site and will form a clot or a plug to block the blood flow. So now here you can see that the blood flow is completely stopped, so that now there is no bleeding due to the injury. So this is what is happening in the case of inflammation, that particular step. So now the second stage, that is proliferation phase. In this actually two different cells are involved mainly. One is epidermal cells and the other one is fibroblast. So this epidermal cells, they will be undergoing mitotic activity, nothing but the division of the epithelial cells. This will start within 24 to 72 hours of injury, and these cells will be migrating towards the wound site. So the epithelial cells are actually migrating to try to close the wound actually. So under the epithelial cells, if you go into deep, fibroblast cells are involved. These fibroblast cells also are proliferated, and these cells can produce a large amount of collagen. So first initially they will produce small amount of collagen, which is acting as a scaffold for migration and further fibroblast proliferation and also further synthesis of the collagen. So this collagen is actually helping for reconstruction of the tissues. So now here in the proliferation phase, this will be happening 4 to 5 days after the injury, and these fibroblasts being producing large amounts of collagen and proteoglycans. These collagen fibers are laid down randomly and are cross-linked to large closely packed bundles. So collagen bundles are formed, and this bundle formation will be fast in young age and will be slow in old age. That is why in old age people the healing process is very slow. Also if the person is a diabetic or if he is under any medication, again the collagen formation and reconstruction will be slow. So in a normal person this is the time period. Now the last stage, that is maturation phase. In this phase also fibroblast will be keep on producing collagen, and this collagen is now remodeled into a more organized matrix. And now the aim of this collagen matrix is to maintain the tensile strength. So that will be increased, but only we can achieve up to 70 or 80%, not to 100% we cannot achieve anyway. Anyway that 80% tensile strength of the skin or the tissue we can achieve, and this will be the final stage of the maturation, and this will be, as I told, it will be going till 2 years. So it's actually a long process, and this is the end of the healing. After healing, this is the result what you can see, that is the final product is a scar. So here in the first picture what you see is the normotrophic scar, that is a normal scar. If the healing everything is proper and if it is well managed, the scar that is developed is called as normotrophic scar. And if the healing is not well managed, you can see two types of scar, that is one is hypertrophic scar and another one is keloid scar. So in this hypertrophic scar, the scar is actually formed along the length of the injury itself, but the scar is slightly thickened. In the last type, that is the keloid type, what you can see is that the scar size itself is actually enlarged, very thick scar, big scar you can see, and these scars also will grow as the age increases. So that is what about the scar. And delays in the healing process cause prolonged presence of wounds. So if any healing process is delayed, then naturally what happens is that the scar also will be thickened and the wound healing also will be slowed down. Then abnormalities of the healing process may lead to abnormal scar formation. So this is the summary of the topic, that is the 3 stages of wound healing mainly, that is the science behind wound healing. So wherever, whether it is a skin or an internal tissue or wherever you see, this is the main steps of healing. And as I told you, the inflammation and hemostasis are combined together or separated, whatever it is, both are okay only. So first portion is hemostasis, that is reducing the blood flow and stopping the blood flow. Next one is inflammation, that is the inflammatory cells will be attracted towards the wound site to kill the bacteria as well as remove the debris. Third one is proliferation. In this proliferation, we can see that the new blood vessels are sprouting from the collagen bed, as well as the epithelialization happens, collagen reconstruction also will happen. In the remodeling, again the 3-dimensional collagen matrix is formed and the wound will be closed and a scar is formed. So next, how can we manage the wound? So usually the wound can be of different chronic wounds, acute wounds, simple wounds. So how can you manage these wounds? So first, whatever the wound, like external wounds, internal wounds anyway we cannot identify immediately. We have to go immediately to the hospital and take the medication. So if it is an external wound, first what we have to do is, first we have to, the person who is taking care of that wound, that person has to clean the hands, because we have to prevent the spread of infection from our hands to the wound. So we have to clean the hand, wearing the gloves or something like some antibacterial gel you can apply to clean the hands. After cleansing, like what you have to do is that you have to cleanse the wound area using a soap or any saline flush you can use to clean the wound area. After cleaning, we can cleanse the skin and we can apply some mild soapy water to remove any possible contaminants. Maybe not only contaminants, like certain things also will be inserted into the wound, maybe a wood piece or a glass piece. So we have to remove all these things and then gently pat the affected area, dry with a clean pad or towel. Next step will be depending upon the type and level of the wound, as I told you. If it's a small wound, we can put a band-aid or something like that, or else if it's a chronic or acute or burn wound, immediately that person has to be taken to the hospital for further treatment. So the healing management is actually very important, whether it is a 0 age or a old age or whatever it is, external wound or internal wound, the management of healing is very important at all the age groups, and proper management will reduce the scar intensity also, and also healing will be healthier. So thank you for listening this topic. Thank you very much.